Professor við Boston Háskóla hefur rannsakað D-vítamín og áhrif þess á mannslíkamans í áratugi. Hann er sannfærður að stór hluti mannkyns þjáist af D-vítamínskorti og með því að bæta þar úr mætti koma í veg fyrir marga sjúkdóma og draga úr þjáningum. Sólarvörn er ofnotuð að hans mati. Húðin þarf að fá tækifæri til að taka upp D-vítamínið úr sólskinninu þótt fólk megi alls ekki grilla sig í sólbaði. Íslenskir næringarfræðingar hafa reyndar barist fyrir því að matvæli verði D-vítamín bætt en það hefur ekki gengið eftir hingað til. Þóra Arnórsdóttir ræddi við Holick.
Welcome, Mr. Holick.
My pleasure.
Now, you've been talking about D-vitamin and D deficiency for decades. Why are you so sure that such a big part of mankind suffers from it?
Well, I realized early on that most humans have always depended on sun for their vitamin D requirement. And over the past 30 to 40 years, the message has been never to be exposed to direct sunlight. And I also realized that there's essentially no food that naturally contains vitamin D. It's mainly oily fish like salmon, mackerel, herring. And so if you're not eating salmon every day, and taking a multivitamin or a vitamin D supplement, and you're not getting sensible sun exposure, then you're very highly at risk for vitamin D deficiency. And that's what's turned out to be the case. I mean, even in Australia, it turns out more than 40% of the population has now been found to be vitamin D deficient.
But what does it do to you?
Well,
how do you know that you're D deficient?
Yeah, I mean, and that's the part of the problem is that it just doesn't, you don't wake up one day and know that you're vitamin D deficient. But often people complain of a lot of aches and pains in their bones and muscles, and that's very classic for vitamin D deficiency. So people, especially in the wintertime, they get up in the morning and they feel like that their joints are a little bit stiffer and they're a little bit more tired and they're a little bit more cranky. And it turns out that they said, well, it's because there's less sun exposure and because it's the wintertime and it's cold. Could be, but it's also because many of those symptoms are associated with vitamin D deficiency.
But it can also be dangerous to get too much of it. De-intoxication is a serious problem if you get it. It calcifies.
Correct. But it turns out that vitamin D intoxication is one of the rarest medical conditions in the world. There has to be really an intentional taking in huge amounts, potentially like 500,000 to 1 million units of vitamin D a day for months at least before you have to worry about vitamin D intoxication. So it's way overplayed, and it's mainly because of the history of vitamin D. Back in the 1950s, there was an outbreak of high blood calcium in infants, and they related it to what they believed was overfortification of dairy with vitamin D. And so instantly, overnight, they passed laws forbidding any fortification of foods throughout Europe. That's still on the books today, even probably here in Iceland. Really not encouraging foods to be fortified with vitamin D. It turns out, likely, those kids had a rare genetic disorder that made them sensitive to vitamin D, that it probably was not due to vitamin D intoxication.
So, I mean, Icelandic nutritionists have recommended that D vitamin be added, or the dairy products will be fortified with vitamin D. Is that the right way to fight D deficiency?
I think so. I think that it's unrealistic to try to convince everybody to go out and be exposed to sunlight like our ancestors did. And rather, it's more important, I think, for everybody to get some vitamin D. And the best way to do that is to have many foods fortified with vitamin D. In the wintertime, even in Boston, from November through February, you can't make any vitamin D. Here at this latitude, you don't make any vitamin D in your skin from sun exposure almost 6 months of the year.
But we've been told for years now to cover ourselves in sunscreen, and not least our kids, if we're just thinking about going out in a strong sunshine. I mean, there's talk of melanoma, of obviously burning your skin, wrinkles, what you have not. That's what we've been told for a long time, that we should not be exposed to the sun without sunscreen.
Correct. And I think that, in fact, just like anything else, it's moderation. That should be the message. So some sensible sun exposure followed by good sun protection makes good sense. And the issue of melanoma, which of course is the most deadly form of skin cancer, it's curious to note that most melanomas occur on the least sun-exposed areas, and that people that have occupations that work outside actually decreases their risk for developing melanoma.
But why is it then that it's on the rise? Is it because we go crazy when the sun comes out and,
Well, there's probably two reasons. The first is that we're much more aware of melanoma, so it's being detected earlier than it was many years ago. So as a result, it looks like the incidence is on the rise. But you're right. The second reason is that it's likely that since we're not exposed to very much sunlight most of the week, and if you go out on a holiday or on the weekends and exposed to a lot of sunlight and get a sunburn, that's what increases your risk for melanoma.
Now, you've also talked about, obviously rickets and osteomalacia, D-vitamin prevents that. But then they talk about other diseases. It sounds like the magic,
right.
the magic thing to do. It will solve all our problems. Diabetes, multiple sclerosis, cancer, heart disease. We would need more scientific proof for that, don't we, or what?
Well, I'll give you some perspective. It turns out that essentially every tissue and cell in your body has a vitamin D receptor. So why would your cells, such as the brain and the colon and your immune cells, have a vitamin D receptor? It's because they need vitamin D. It's been estimated at a minimum 200 and maybe as many as 2,000 genes in the body are directly or indirectly regulated by vitamin D. We know, for example, that it will regulate cell growth, it will help maintain cell growth and reduce risk of cells becoming malignant. If a cell becomes malignant, vitamin D plays a role in shutting down blood vessel formation so that the tumor can't get enough nutrition, and it also induces cancer cells to die. So we think that some of the data that's out there is suggesting that vitamin D deficiency increases risk for colorectal cancer and breast cancer has some validity to it. We did a study in pregnant women in Boston. The recommendation right now, even by the Institute of Medicine in 2011 in the United States, is that pregnant women should be getting 600 units of vitamin D a day, or 15 micrograms of vitamin D a day. And we looked at 40 mothers who were getting a prenatal vitamin, drinking 2 glasses of milk a day, getting 15 micrograms of vitamin D a day. At the time they gave birth, 76% of moms, 81% of newborns were vitamin D deficient. Why you should care? Because we also went on to show with Dr. Bodner that preeclampsia, the most serious complication of pregnancy, was associated with vitamin D deficiency. And we also know that vitamin D is very important for muscle function, which of course plays a role in birthing. And so when we looked at over 200 women at our hospital giving birth, that it reduced their risk of having a C-section if they simply were vitamin D sufficient at the time that they gave birth.
But when you look at a nation like the people living here in Iceland, we don't get much sun. We're probably almost all D deficient according to those standards. But we live longer than most people, most of the nations on Earth.
Well, I think that, there's a lot of chronic disease, and it looks like it's on the rise. And you have to wonder whether some of that is, in fact, due to vitamin D deficiency. Because even here in Iceland, I think that fish was a more significant part of your diet 20, 30, 40 years ago, and that's where you were getting your vitamin D. Cod liver oil, which was routinely given to children, in schools, for example, was an excellent source of vitamin D. So listening to your mom back when, and taking cod liver oil, as bad as it tasted, was really important for their health.
So you say 1,000, 2,000 units a day?
Well, I recommend about 1,000 units a day for children, 2,000 units for adults. I personally take 2,000 units a day, and from all my other dietary sources, I'm getting 3,000 units a day. We did a study in my patient population because I give them an equivalent of 3,000 units of vitamin D a day. And because it's a fat-soluble vitamin, people think it's going to build up in your body and then it's going to cause toxicity over time. It does not. It raises your blood level up to a level that we want it to be at around 40 to 60, which we consider to be a healthy level, and it's maintained for 6 years at that level. So I'm confident that children taking 1,000 units a day, adults taking 2,000 to 3,000 units a day will satisfy their requirement.
Thank you very much for being with us,
My
Mr.
pleasure.
Holick.
Thank you for the opportunity.